I think there are three things I can think of immediately. One is that it's so new. I mean, we've been dealing with it for just about 6 months, globally for about 9 months to a year. And I think there's new information every week, and just keeping up with that and learning or knowing how to advise persons, how to advise our staff, our patients, their relatives, that has been one of the difficulties, because the information changes ever so often, and there's also so much misinformation out there that people tend to cling to. And so even as we share information, we have to deal with persons relying on information that is not factual, to inform their decisions. The challenge with that, my second point, is that persons have not necessarily been adhering to the advice that is coming from reputable sources, such as the ministry, PAHO, the hospital, and other health experts. And while we understand not everyone may get critically ill, what we want people to understand is that they can transmit to other persons who are likely to become critically ill. I think the third challenge has been the emotional and the psychological component of it. Like I said, our staff have been working so hard. I know so many staff personally who've been making major sacrifices, being away from their families, having to make major life adjustments because of the kind of work that they're now doing due to COVID-19. And I think every time we're faced with a situation where persons are not adhering to advice, where we have persons challenging our staff when they come to the hospital simply because they feel like two of them should accompany a patient rather than one, it can be difficult for our staff, you know. And then there's all, like I said, we don't have a perfect system, we don't have perfect staff, but I think they have been working really hard, and it can be really demoralizing for them sometimes too, when people, you know, make it difficult for them to do their work, if I can put it that way. So those are three of the challenges that I can think of immediately. Of course, there are several others, but those have been, for me, the most challenging three. As you know, we have put measures in place to ensure that the hospital is safer during the time that we're dealing with COVID-19. One of those measures is that we have limited, or we've restricted visitation to the hospital. The gazetted order says no visitation to hospitals. As a corporation, we understand that, you know, persons who have sick relatives in some of the wards might need to come and visit to provide them with meals or clothing, and, you know, even emotional support, if we can put it that way. And so while we have restricted visitation to the hospital, we've also allowed some flexibility for some of our patients. For some wards, there is absolutely no visitation. Infectious disease ward, of course, any patients who are in the hospital who are suspected to be COVID-19 positive, who haven't had a positive result as yet, we do not allow relatives to visit them because of the likelihood of transmission. As it relates to our accident and emergency department, most of our patients enter the hospital through A&E. A person gets into an accident, they're feeling a pain that they can't describe, they come to the accident and emergency department to get treatment, immediate treatment, care and treatment. We have insisted that for this period, only one person can accompany that patient. And reason being, sometimes that person is unable to walk, and like I said before, they need the emotional support when they're coming in the hospital. You need someone to give the nurse or the doctor their medical history, to give them their, you know, their information and so on.